I'm just going to give you a brief rundown on Canada's Safety Code 6. Canada does not go strictly according to ICNIRP or the FCC, but we have what's called Safety Code 6, and some of the people here were actually involved with the latest revisions and a bit of a saga in terms of that. So Health Canada reviews for health the guidelines for electromagnetic radiation, and for both non-ionizing and ionizing radiation, and then it is administered through Industry Canada. Now, they revise their guidelines roughly every 5 years, except it's a very long process, so it always kind of rolls over. And the previous time was 2009. So they started off on their 5-year review in about 2013, and we realized that there was a bit of a problem here. First of all, the Royal Society of Canada, scientists were appointed there, and they were supposed to be doing the scientific review. So Health Canada provided the research questions, which were evidently confidential, and they also supplied all of the materials, which was also at the time confidential. There were quite a few members there through various means. The Canadian conflicted Royal Society panel members were stepped down, but there were a few who were potentially conflicted who were from the States who remained on the panel. So in 2013, the Royal Society came out with their review, and my experience has been in clinical scientific review of medications, and in clinical scientific review we have what we call systematic review, where you do huge searches of all the literature, you sift through it all, and you pick out what's relevant. It's a very specified process. And when we looked at what had actually occurred, basically none of the key elements of systematic review were present in the review by the Royal Society of Canada. And so to sort of double check that, you see, what Health Canada and the Royal Society of Canada did was they sort of hedged their bets, saying, well, we are also relying upon other authoritative reviews. And I can't tell you all of those acronyms, but the latest reviews from a lot of different experts. So what happened was that we ourselves gathered the literature that we could as volunteers, and we went through the literature, the literature lists, the bibliographies in every single one of these studies. And then we identified what was, amongst all of those studies and the Royal Society report, all of the bibliography there. We compared that with our bibliography, and after that, we realized there were 140 studies that we identified as volunteers without the big expensive software that indicated harm that were never mentioned in any of these authoritative reviews, including the Royal Society of Canada. So there was also this kind of got the attention of some of the parliamentarians, and I have to really thank the Canadians for Safe Technology, headed by Frank Clegg, who really helped to catalyze a lot of this. I also have to thank several people in this room, including Deborah and Darius and Anthony Miller, who were all appeared before this parliamentary committee. So we had 3 afternoons of hearings. They heard quite a few witnesses from all sides of the story, and they came out with 12 recommendations. And they were excellent recommendations. I think a lot of those recommendations are going to be reflected in some of the materials that are coming out of this meeting. They dealt with systematic reviewing of what we know, and then building our knowledge, awareness campaigns of the hazards and of the risks and safer ways of doing things, and also Right to Know, all things that you've heard of before. And these were from our Parliamentary Health Committee. The process is that they then go to the Minister of Health, and the Minister of Health then acts on these recommendations. Well, unfortunately, we had actually, first of all, I should just mention that during the process of these hearings, the parliamentarians, not surprisingly, said to the Health Canada people, well, excuse me, but what about these 140 studies? And so the Health Canada people went back, and they said of these 140, there are 38 that would be in scope, and of those 38 that were in scope, in other words, they were appropriate study design and so on, that those, there were ones that were below Safety Code 6, which is 1.6 watts per kilogram SAR. And so those ones that were below that SAR that was specified within had resulted in brain abnormalities, reduced activity, gene damage, genetic damage, and even down at very low levels, we're looking at DNA damage, thyroid cell stress, and so on. So these are all fairly significant potential health impacts, all within the literature that should have been considered, but wasn't.
I'm sorry, Meg, what is the blue bar on the far left?
Oh, it's just a visualization of zero.
Oh.
We have a blue bar at 0, a blue bar at 1. Yeah. It's the blue bar is really nothing apart from an easy visualization at a distance of 0.
It's just a, within the path of 45.
No, it's just a marker. There's no significance to the height of the blue bar. Sorry, sorry to be confusing there. Yes. So anyway, these were all things that were not considered in the revision of Safety Code 6. So the Health Canada response after the election was basically just written by the Deborah's whispering industry under. It was written by Health Canada staff. And what happened was nothing. There's little change. There's no systematic update. They have not even acknowledged the National Toxicology Program recommendations within this. They only talk about the IARC 2011 review. And their advice is of the, if you are concerned, and indeed in Industry Canada's advice, they say that our RF guidelines are safe, and if, despite the evidence, you prefer to reduce your RF exposures, these are some things you could do. So we're a little bit upset about this. So next steps will be to, fortunately, Deborah's coming to Canada for a couple of months, but we'll be briefing parliamentarians, carrying out public education. We're working across the board to improve scientific approaches in literature review and meta-analysis. This is something that's been one of my pet projects for quite a few years, and it's actually been implemented within pesticide assessment in Canada. So I was quite thrilled about that. They're actually buying the infrastructure to be able to do that. We're also encouraging solutions from industry, because we're saying, look, this is coming. Industry is going to have to produce safer things. BlackBerry really didn't do all that well lately. This is an opportunity that you guys should be hopping on board. And so I chair Prevent Cancer Now, and I work with Environmental Health Trust. I'm so honored and privileged and really grateful to be here. And Canadians for Safe Technology, Frank was unfortunately not able to be here, but he helped to get me here. And so I really thank everybody here for their past support, and hope that you can help us to do good things in Canada going forward, and certainly we'll be using some of your work.